Hello people, in this video let us look at the effects of atmospheric pressure on health. So basically what we want to look at, the effect of atmospheric pressure on health, okay. So basically this is a community medicine topic. So what is this atmospheric pressure, guys? It is the pressure exerted by the air, that much you know, right? So it is what? It is the pressure exerted by the air, correct? So basically the atmospheric pressure at sea level the pressure will be something else, and at above the sea level the pressure will be something else. So what is the atmospheric pressure at sea level? It is 760 millimeter of mercury. What is it? It is, let us take a nice color here, 760 millimeter of mercury. Remember to measure, put the units correctly. It is pressure of mercury. It is 760 millimeter of mercury. It is called as 1 atmospheric pressure. This is called as what? 1 atmospheric pressure. It is 760 millimeter of mercury. It falls as this one. It falls. That means it falls. It becomes less as the altitude increases. So as the altitude increases, right, the pressure decreases. Okay. So look at this, guys. So low pressure is where there is high altitude. So the pressure falls as altitude increases, and it rises. The pressure rises as altitude decreases. You can see here. So this is pretty clear for you, right? So what are the effects of atmospheric pressure on health? So our discussion today is what? In this video, we want to discuss the effects of the atmospheric pressure on health, correct? So if you remember, that was the topic. Effects of atmospheric pressure on health. So man is physiologically adapted to live at 760 millimeter mercury or around it. So he can live around that, around what? 760 millimeter of mercury. Around this pressure he can live. He is adapted to live around this pressure. Any change in the pressure will have adverse effect on health. Okay. So let us look at all that. Okay. So let us look at the effect of pressure on health. Okay. So basically, if there is diminished atmospheric pressure at high altitude, what will happen? So they are talking about high altitude now. So here they want to talk about this one, effects of diminished atmospheric pressure at high altitude. What will happen at this high altitude? Okay. At high altitude, the air becomes thinner. So here what is thin? The air is thin. Okay. So obviously it will exert a lower pressure on the human body. The partial pressure of oxygen also becomes less, and man cannot survive at an altitude of 25,000 feet without breathing equipment. So if it is beyond 25,000 feet, he cannot survive. So if you know an aeroplane, when it is going in cruise altitude, the aeroplane will be going at around 32 or 33,000 feet. So obviously it is beyond the survival level of a human. So how do they manage this? They manage this by pressurizing your cabin. So you can see here, guys, the aeroplane shown here. So it is much higher in altitude. So the pressure will be very low. So you will not be able to survive. You are able to survive in the aeroplane only because the cabin is pressurized. Okay. So at high altitude, the air becomes thin. There is a low temperature also. The partial pressure of oxygen is also low. And hence, man cannot survive at an altitude 25,000 feet. Okay. Without breathing equipment, he cannot survive. Okay. So here, what and all are the changes that happen? Acclimatization. So you should know these terms. What are the terms you should know? Acclimatization. So basically, we are talking about high altitude. So acclimatization, you already know this. So exposure to high altitude forces the human body to acclimatize to high altitude. So what will happen? It will, the rate of respiration and the depth of respiration will increase. You know this term acclimatization, right? We have a separate video on that, I think. So this is just nothing but you're, adapting to that environment. That's all, acclimatization. So basically here what and all will happen as a part of acclimatization in high altitude, guys? Rate of respiration will increase, the depth of respiration also will increase, the hemoglobin concentration of blood also increases, there is increased cardiac output, okay? Then acute mountain sickness. Acute mountain sickness. So what is this acute mountain sickness? It results due to sudden exposure to high altitude of about 10,000 feet. Sudden exposure. Acute mountain sickness. So that's why they say when you climb a mountain, you should climb it gradually. You should not climb all at once. You should not, the next day you should not reach at Mount Everest. Slowly at every base camp, they, stay there so that their body can acclimatize to that environment. Okay. Then, what happens here in acute mountain sickness? What are the clinical features? There will be a headache, fatigue, irritability, irrational behavior, loss of muscular coordination, impaired vision, insomnia, nausea, vomiting, breathlessness, bleeding from nose, ringing in the ear, palpitation, collapse also can happen in severe cases. How do you treat an acute mountain sickness? The best treatment is to just take the person to a lower altitude as soon as possible. Okay? Then, let's go to the third thing that happens at high altitude. High altitude pulmonary edema. Okay, so we are reading this one now. High altitude pulmonary edema, serious complication of acute mountain sickness. They are saying this is serious complication of acute mountain sickness. This is high altitude pulmonary edema, which occurs around the third day of high altitude. So at the third day, on the third day, this happens. There is, what are the clinical features? There is going to be cough, irregular or chain strokes breathing, oliguria, mental confusion, hallucination, stupor, seizures and coma. So here they said he might maximum collapse, right? But here they are saying he might go into coma. He will have seizures, right? Mental confusion, stupor. What is the treatment again for this high altitude pulmonary edema? You bring the person to the lower altitude as soon as possible. So now let us talk about the next thing here. High altitude is over. Let us go lower down, low altitude, like scuba divers, etc. So here what happens? There is going to be increased atmospheric pressure. At low altitude, what will happen? There is increased atmospheric pressure. Guys, you remember, right? We have already shown you all the details here. At low altitude, there is going to be increased atmospheric pressure. It can even happen in mines, guys. It can happen under the sea, right? In mines, etc. So don't forget mines, okay? In the sea, in the mines, all this can happen. So what exactly happens here? Dissolution of blood gases. Okay, so here what happens? At high atmospheric pressure, the blood gases dissolve in blood. Okay, so the blood gases, they dissolve in blood and the tissue. Okay, so based on their partial pressure, they're going to dissolve. This causes various manifestations. What are the manifestations? Loss of mental function and consciousness. So there is loss of mental function, loss of consciousness due to narcotic action of nitrogen, which is facilitated by carbon dioxide. So basically here the biggest problem, they seem to be blaming it on nitrogen, which is also facilitated by carbon dioxide. So they are saying here these will dissolve, right, into blood and tissues based on their partial pressure. There can be convulsions and death also can happen due to excess oxygen. Interestingly, the death here they are saying is because of excess oxygen. Interesting. So people, we are done with this one. Dissolution of blood gases. Okay. The next point is decompression sickness or Casson's disease. Okay. We are done with dissolution of blood gases. Now we are going to decompression sickness or Casson's disease. Okay. Here what happens? As the person rises to high altitude. So now they are not talking about him being there down. They are talking about him rising to high altitude. The dissolved gases are liberated, causing bubbles in the tissue and blood. So whatever had got dissolved in the blood, they are going to come out now. The bubbles, okay, they are going to come out of the blood, okay, and they will cause bubbles in the tissue and blood. So this is actually, there are some specific words here, right? Bends. Okay, let us look at the clinical features of this. Clinical features of decompression sickness. So he's coming out of high pressure, so he's getting decompressed, let's say. So decompression sickness or Casson's disease, what are the clinical features? Euphoria, he's very happy, euphoria. Sensation of increased strength, wow. Because he's coming from high pressure to low pressure, he will feel like he has a lot of strength maybe. So increased strength, He has sensation of increased strength, deeper and quicker respiration, stronger and slower heart, nasal voice, disturbances in hearing, change in smell or taste. There can be hemorrhage from the mouth. This looks dangerous. Hemorrhage from mouth. Hemorrhage from mouth or the tympanic cavity or lung. There can be hemorrhage from any of these places. Severe pain in muscles and joints. Because of these gas bubbles, there will be severe pain in the muscles and joints. This is called as bends or screws. Okay. Bends or screws. And death can happen because of gas emboli in blood. So we told you what is coming out of the blood, the gases. So they are forming bubbles. These bubbles can cause gas emboli in blood, and that gas emboli can lead to death. So this gas will go and block one of these important vascular structures, and it can lead to death. Okay. How will you treat decompression sickness? This is important, guys. Treatment of decompression sickness. You should always do recompression and then slowly do. They are saying here you should, the treatment is recompression followed by gradual decompression. Recompression. So maybe we should push him into water again. Recompression and then slowly gradual decompression. So he should not come up fast in this water. He should come up slowly in the water. Level by level he should come up. That would have not at all created the problem in the first place. So when you're climbing mountain also, remember, climb the mountain slowly. When you're coming up from scuba diving, come up slowly. Okay. So now what do you think? As of now, the conclusion for us is what? Basically, sea level, around that, the pressure is ideal for us, 760 millimeter of mercury. Remember, Earth provides us very good atmospheric pressure for sustenance of life. So if you were to go on moon or somewhere else, where is this? So this could be really difficult to survive because of the conditions there, the pressure, the oxygen levels, everything. So what's the significance? Any drastic change in altitude, either lower or higher, is hazardous. One should give enough time for the body to acclimatize to avoid these serious, fatal and sometimes even fatal events. So always when you're climbing the mountain, climb slowly. When you're going down, probably also you can go down, and scuba diving when you're coming up, come slowly. Looks like when you're coming up, no, you should come up slowly. Whether going up the mountain or coming up from the scuba diving. When you're going up in life, gradual steps will help. So high altitude, remember, acclimatization, acute mountain sickness, high altitude pulmonary edema. Say acclimatization. Acclimatization. Say acute mountain sickness. High altitude pulmonary edema. Edema. Yeah. So basically when you climb the mountain, you should climb slowly. You should give time for the body to adapt to each level. Okay. Now when you go down into the sea, right, to catch fish and all, they'll go to see the fish and all. That's called as scuba diving. So once they're done with the scuba diving, when they're coming up, they should come up slowly. Otherwise what will happen? Dissolution of blood gases, decompression sickness or Caissen's disease. Say Caisson. Disease. Bends. Or screws. Thank you. So that's all, guys, in this video. So in this video, what and all we have covered, just take a quick recap. Effect of atmospheric pressure on health. So best suited is around sea level. High altitude, there will be low pressure. Low altitude, there will be high pressure. So you can know that Earth is best suited for us. We cannot survive on any other planet. So basically you know what is the cruise altitude, how an aeroplane maintains the pressure for you so that you will not be uncomfortable. High altitude, what happens? Low altitude, what happens? And that's all in this video. Bye bye.